Hi there and good to see you again. This is Unit 8. It's going to be a 5-part video lecture series here in this particular section when we talk about infectious diseases corresponding with Chapter 14 in your text. There's a lot of things to cover here, so I want to break it up into smaller chunks and make it a little bit easier to digest for you. We'll skip on past the introduction slide. You're welcome to pause on that. But first thing we're going to talk about really quickly is Koch's postulates. And Koch was a German physician who mainly studied anthrax in cattle, but really is one that is primarily responsible for really doing a lot of research on causative bacterial agents, different disease and infectious disease principles, and really has helped establish the germ theory that we know today, and kind of started to lay the groundwork for understanding contagious disease and how some of them are much more infectious than others and how they affect livestock. So of course, when we look at different disease agents, and there's many different classes of them, of course, bacteria and viruses would be the top two that would come to mind, and I have some pictures here on the right side of the screen that show you just a little bit of what some of those might be. But also don't forget about fungal problems that we may have, prions, which for example would be mad cow disease, or even parasites. All disease-causing agents that are going to be important for us to understand how to battle effectively with our livestock. So as we continue to kind of look at different stages of infectious disease, and I've got an arrow here kind of depicting the progression of a disease. Of course, we have first infection, and sometimes you may not even know that you've been infected. You may not know that you've been exposed to the virus or bacteria. There's typically an incubation time that then sets in. It might be just as short as a few hours, and it might be several days, weeks, or months. Then there's what we call the prodromal phase, where there's fever, headaches, or some kind of clinical onset to the disease that kind of starts to set in. Of course, then followed by an acute period, then some kind of period of decline where you're beginning to fight off the disease, and then a convalescent period where now you're building up immunity or antibodies or have a recovery phase. This slide is very, very busy, and of course I'm not going to take the time to read all these to you, but a list from your text that goes over a lot of common bacterial diseases in livestock and companion animals. And it begs time for you to stop and pause the video lecture here and kind of review some of them, because it goes through the disease, the different species, the causative organisms, and the signs of it. It'd be great for you to know them. In fact, probably lots of questions will come from these next couple slides here. Same thing when we talk about common viral diseases, and there's many, many of them for you to think about and be able to understand what to do with on your operation and with your animals. How do you battle these? How do you prevent them? What vaccines are important to maybe consider exposing your livestock to in order to help fight these off? Different disease ages, things that hinder growth. How can we begin to prevent now disease? First thing is we have some germicides available. And there's, of course, then antiseptics and disinfectants. Now, there's a difference between those two. One is applied to inanimate objects, and a disinfectant, or antiseptics would be applied to the skin. For example, iodine is a great antiseptic. You can apply it right to the skin, and it's a great germicide. And then also you can use disinfectants. For example, like Clorox would be a great disinfectant. You can soak some of your materials or tools in a disinfectant and help kill off any germs that might reside on an inanimate object. Of course, then we've got antibiotics that kill bacteria but don't really work on viruses very well, but are certainly helpful at either killing or managing bacterial load. As we kind of get to the approaching the end of this first mini lecture set, I wanted to set up just a few examples in terms of clinical practice here. It's really important whenever you're dealing with disease issues, and especially if they're somewhat unknown. Culturing is a great technique to help you isolate microorganisms. Helps you identify what you're dealing with, and of course then what they are susceptible to in terms of treatment, uh, supportive therapy, etc. So the first things that you would want to do is either yourself or work with a veterinarian and obtain a representative sample. You take that sample and add it to a medium. For example, it's got some petri dishes here on the right where you may have basically inoculated the different media here with your sample. You allow it to incubate for a period of time that might be, again, just a couple days, um, which allows time for growth. And for example, the picture on the right side of the screen here, they've dropped little treatment discs on it to see which one repels the disease, repels the bacterium the most. That gives you an idea then what to do. You can do that sensitivity test. I mentioned placing those antibiotic saturated discs on the culture. That diffuses into the medium, and you see an effective ring that begins to form. The larger the ring, the more effective the antibiotic is. And on occasion, when you're dealing with something that's rather unique to your operation or to your particular disease, that's a great opportunity to figure out what exact antibiotic you should be using. Really important that you use the correct one, of course. And when we use antibiotics incorrectly, that starts to lead to antibiotics that create a resistant strain, or to bacteria that create resistant strains to those antibiotics. So using them in the incorrect dosage, using the incorrect antibiotic altogether, not finishing your antibiotic therapy protocol, can develop bacteria now that they develop a sensitivity to it and therefore eventually resistant. So use the adequate dosage. Treat them on time correctly. And so if your veterinarian or your protocol requires or suggests 5 days of antibiotic therapy, finish the 5 days of antibiotic therapy at the correct dosage. Hopefully, those resistant strains then don't develop, because those are very difficult to kill and eliminate once you have them. Another thing when we talk about clinical practice, and especially when we refer to parasites, is we can go through sampling and do fecal flotation. And this is actually a quite simple process. Is you get a fecal sample, and there's some tools that are pictured on the bottom right hand side here. You get a little bit of distilled water, and you basically just float the sample, and parasitic eggs will float to the top, and all you have to do really then is take a microscope slide and touch it to the top of the vial, and those eggs will stick to the slide, and you can turn that slide over, set it on your microscope, and identify any parasites. If you need to enhance this, you can centrifuge them out as well. But this technique is actually pretty simple to do. Further on parasites, most of the time young are most susceptible, especially for the debilitating kind of parasites that can really affect their growth and development. So you want to be very aware early on. I've got ticks pictured here at the bottom. Of course, ticks can really get after puppies and kittens, and really can carry some nasty diseases along with them. But as an animal ages, as we age, we develop some immunity, and so therefore some of that stuff gets less problematic or less clinical as we go along. But parasites are treated with what we call anthelmintics, and those can be applied as a pour-on. They can be injectable, they can be oral, a number of ways that we can apply anthelmintics for treatment of parasites. Endotoxins, then, of course, we got bacteria that can develop endotoxins. Sometimes we get the sudden death of bacteria releases whenever we get endotoxins. Think about tetanus in this regard. So sometimes we need a pretty heavy dose, high doses of antitoxin and probably some other supportive therapies to help block some of the effects. You got a picture of a cow here that's dealing with something very difficult, of course. So you have to be aware of some of those potential problems. One of the things that we want to lay out through this whole section on disease-causing agents is identify the risk factors that you have on your operation with your livestock or your companion animals, so that then you can come up with preventative strategies in order to help fight them off. Don't act in a proactive manner, not in a reactive manner. You'll always be ahead in that regard with regard to diseases. So we'll pause here and conclude the first section, take a quick break as we get ready for the next section on disease-causing agents. Thanks for tuning in.